Hey y'all, welcome back. In this video we're going to be reviewing the Femostat. The Femostat is used when we are removing a venous or arterial sheath, obviously in the femoral vein, from the femoral vein or the femoral artery. It can also be used if we're having a venous or arterial femoral bleed, as this could be after sheath removal. Usually we're going to try and put this on whenever we have a sheath in place that we're going to remove, but also say one has already been removed, then we could place this on there if, say, a hematoma or bleeding started to develop. So we're going to go ahead and show you how to do that. So the first thing you want to do is lay your patient flat. And essentially, if your sheath is in place, it's going to be in the fem. But if this patient is bleeding, then obviously you're going to have somebody holding pressure on the groin while you get the Femostat. So the thing about the Femostat is you have to have an order from a physician to apply it. So you want to make sure that you get that order before applying it to your patient. Otherwise, you're just going to be doing manual pressure. Maybe you'd need a sandbag or something like that, but you definitely need a physician order for your Femostat. So this is your Femostat. It's going to come in a package like this. It's going to be in both supply areas, and I'll go ahead and open it now to show you its contents. So when you open your Femostat, you're going to have a few things. You're going to have a white strap, which I currently have under the mannequin already, but this white strap will just be rolled up and it'll be in your packaging, and we'll talk about the white strap in just a sec. In addition, you're going to have the actual Femostat, which looks like this, and attached to it's going to be something that looks kind of like what you have on your manual blood pressure cuffs, and then you're going to have your directions in here. So that's pretty much what is in there. We're going to be going over these directions, but essentially you're going to have somebody, maybe they're holding pressure, or maybe this is prior to removal. What you're going to do is, once you take out the contents, you're going to roll the patient side to side, and you're going to place your white strap under them. This strap, you should try and make it as even as possible. I'm in here by myself, and so when I did it, a bunch of it went on one side than the other, but you would ideally want it to be as even as possible. And then what you're going to do is you're going to remove the seal here. And so when you remove the seal, you want to make sure that you're keeping the dome as sterile as possible. Obviously, like, it won't remain sterile once it's on the patient, but you want to make sure that really nothing's touching this once it's removed. The other thing you're going to want to do is remove your red clip here. So all it's going to do is activate your electronic pressure reader. So once you remove it, then you'll be able to get numbers on here. So then basically what you're going to do is, once you've rolled your patient side to side, you've taken off your dome cover here, and this is remaining as clean and sterile as possible. What you're going to do is, on each side you have these, it's going to look like this. So basically, to put the strap through the Femostat, all you're going to do is press down here, and then you can slide your strap through on each side. Obviously, you're going to have the dome on the side where the hematoma or the sheath is, and you're going to see that from the top, it's going to have kind of that middle section here where all the lines are popping up. This is going to be essentially a little bit above and to the right or the left, depending on which side you're putting your Femostat on, above where the sheath was. So I'm going to show you here. It's actually here on the directions. So as you can see here, you have your sheaths in place, and you're going to have your Femostat a little bit above and to the side of where the sheaths are if you're taking the sheaths out with the Femostat. Obviously, if the sheaths are not there and you're putting the Femostat on for a patient that's bleeding, then you're just going to place it over the groin. So That's that. But yes, basically what we're gonna do is we're going to open these up and we're gonna put these straps in through these clips. Okay, so we're gonna go ahead and do that now. So once you place your Femostat on, you want to make sure that this is as straight as possible so that way the pressure is evenly distributed. Once you have your Femostat in place, basically, if your sheath is still in place, depending if this is a venous or arterial sheath, you're going to remove it at a certain pressure. And similar to your blood pressure cuff, you're going to your manual blood pressure cuff, you're going to have your dial here that you'll open all the way out, and then when you put it all the way in here and then you start inflating it, basically what's going to happen is it's going to start inflating on this dome, and that's what's going to be applying pressure. You're going to see the specific pressure that's being applied here. So what you're going to do is, if this is a venous sheath, you're only going to inflate to 20 to 30 millimeters of mercury for the venous sheaths. And once you get to that 20 to 30, you can go ahead and remove the sheath, and this will keep pressure over the site. If this is an arterial sheath, you want to essentially look at what your systolic blood pressure is, and you're going to inflate to 10 to 20 millimeters of mercury above your systolic pressure. And once you get to 60 to 80, that's going to be when you can remove your arterial sheath, and then you can inflate to 10 to 20 above the systolic blood pressure. And all of that is in your Femostat policy that's in Policy Stat. So again, basically what we've done so far is we put the head of the bed down, the side rails are down. If they were bleeding, then we would call for help and hold pressure. We would get an order for the Femostat placement, and we would roll side to side with one person holding pressure to place the white strap under. We're going to put the white straps in our clips here, starting on the side where we're not holding pressure. And then we're gonna apply the clip as well on this side. We're gonna make sure that this is as straight as possible to evenly distribute the pressure. We're keeping, again, that dome as clean as possible until it gets to that patient's site. And in addition, we've taken off the red clip here at the end. Once you get to 20 to 30 millimeters of mercury, then you can take out your venous sheath. Once you get to 60 to 80 millimeters of mercury, then you can take out your arterial sheath, and then we're going to continue to inflate to 10 to 20 above the systolic pressure. After this, you're going to keep, you can lock your tubing with this lock here. We're going to keep this here for about 20 minutes to ensure that a hematoma doesn't develop. At the same time, what you're going to be doing is checking your distal pulses on that extremity. So we're going to check our post-tib and our dorsalis pedis pulse. We're going to go ahead and keep this in place for however long the physician asks. Typically, once we're going to go ahead and remove, we're going to remove the pressure slowly, so we'll decrease by 10 to 20 millimeters of mercury every couple of minutes, and we're going to just observe for hematoma to see if it's being placed or not, and at the same time we're going to check those distal pulses on the patient. That is your Femostat. So just make sure that you get your physician order, you apply with another person, and that you inflate per the policy and you keep it in place per your physician order. During this time, obviously, we're going to make sure that our patient isn't moving around and that they remain flat. If we need to put them in reverse Trendelenburg, then we can, so that way their head of bed is slightly increased. But we're going to want to keep them flat like so, and just continue to monitor those distal pulses. If you're losing your distal pulses, then obviously we need to decrease some pressure on the Femostat. But that is all. If you have any questions, please reach out or put some stuff in the comments. I'm going to leave some links to another video that I found super helpful. And then you can always look on Policy Stat for our Femostat policy. So that is all for this video. I hope you enjoyed it, that you learned something, and I'll go ahead and see y'all guys in the next video. Thanks, bye.